Welcome back to a brand new episode of Review Remedy by ScoreDoc. I'm Ava Dawson, and today we're talking about something a whole lot of people can relate to way too quickly. Back pain, neck pain, that nagging stiffness in your shoulders, or just chronic discomfort that keeps showing up day after day.
And I'm Daniel Garcia. Honestly, this is one of those topics that feels almost universal now. You sit too long, you stand too long, you commute, you lift something wrong once, you sleep weird, and suddenly your body is sending you a very firm message.
Exactly. And for a lot of people, it starts small. You tell yourself, it's probably nothing. Maybe it's stress, maybe it's posture, maybe you just need a little rest. And sometimes that is true.
But sometimes it sticks around. That's the part people don't love talking about. When discomfort starts affecting sleep, work, driving, exercise, or even just getting through a normal day, it stops being a minor annoyance and starts becoming something that needs real attention.
And in a city like Los Angeles, where life moves fast and healthcare options are everywhere, figuring out where to go for help can feel kind of overwhelming. There are a lot of clinics, a lot of websites, a lot of opinions, and not all reviews give you the same level of clarity.
Right. A 5-star rating by itself doesn't tell the whole story. You want to know whether patients consistently mention professionalism, communication, how the staff treats them, whether appointments feel organized, and whether the overall care experience seems dependable.
That's what makes this episode useful. We're focusing on the 3 best-rated pain management clinics in Los Angeles, California in 2026, based on the ScoreDoc report comparing 32 pain management clinics in the area.
And just to level set, pain management clinics are there to diagnose and treat pain conditions like back pain, nerve pain, joint issues, neck pain, and other chronic pain concerns. The goal is usually to help patients reduce pain, improve function, and get a better quality of life through a treatment plan that fits their situation.
We're also keeping this grounded. This list is based on measurable patient review patterns over the last 24 months. It's a starting point for research, not a substitute for your own verification or medical advice.
Yeah, that distinction matters. Review analysis can help identify clinics that stand out in patient feedback, but it does not determine medical competence. It helps you see how people are experiencing care now.
So if you've been trying to make sense of pain management options in Los Angeles, stick with us. We'll talk first about some simple, natural ways people often try to ease everyday pain. And then we'll break down how ScoreDoc built the list before spotlighting the 3 clinics that stood out.
Before we get into the clinics, let's talk about something practical. Not every ache means you immediately need specialized care. For mild discomfort, doctors often suggest simple lifestyle adjustments first, and honestly, some of them are very doable.
Yeah, and listener-friendly is the key here. We're talking about habits like walking, gentle stretching, yoga, mobility exercises, posture breaks during the day, and just regular, gentle movement instead of staying still for hours and hours.
I think people underestimate walking. It sounds almost too basic, which is probably why it gets overlooked. But regular walking can help keep the body moving without putting too much strain on it.
Totally. And yoga or simple mobility work can be helpful because a lot of discomfort is tied to stiffness and limited movement. Not always, of course, but often enough that building flexibility and control can matter. Even 5 or 10 minutes of careful movement during the day can feel different by the end of the week.
And posture breaks. That one feels very 2026, doesn't it? If you work at a desk or spend a lot of time on your phone, just interrupting that position regularly can be a big deal. Stand up, reset, move your shoulders, walk a bit.
Right, because sometimes the body is basically saying, please stop freezing me in one shape all day. That's not very scientific wording, but you get what I mean.
It works. And if those simple measures are not enough, or the pain persists and interferes with daily life, that's where pain management specialists may come in.
So how did ScoreDoc build this list? Briefly, the report looked at measurable review data from major review platforms used by consumers, specifically Google, Yelp, and Facebook. The analysis considered overall rating, review volume, recent review activity, sentiment patterns in written comments, and reputation indicators over the past 24 months.
And I really want to underline the recent review activity piece. Reviews from years ago can be useful for background, sure, but they may not reflect what a clinic is like today. Staff changes, scheduling changes, communication improvements, or problems, those show up more clearly in newer feedback.
Exactly. That's why the report notes that many patients consider reviews older than 2 years outdated. More recent comments can give you a better sense of current operations, current patient satisfaction, and the clinic experience people are having right now.
It's also not just about the star number. Sentiment patterns matter. Are patients repeatedly describing attentive doctors, smooth visits, supportive staff? Or are they flagging the same friction points over and over, like wait times or communication issues?
And that balance is useful, because even highly rated clinics can still have recurring operational comments. Seeing both strengths and possible pain points makes the information more realistic, which, honestly, is what most people want when they're choosing care. All right, let's get into the 3 clinics that stood out in Los Angeles. First up is Daniel Payne Clinic. This clinic had a 4.9 rating, 35 total reviews, 3 recent reviews, and a positive sentiment score of 97.1%.
What stands out in the review themes here is professionalism and compassionate care. Patients frequently mentioned positive treatment experiences and appreciated the attention given to their individual pain concerns, which is a strong signal when people are looking for personalized support.
And the feedback overall points to strong satisfaction with quality of care and clinical support. There were also some comments suggesting communication and administrative processes could be improved. So that's part of the full picture too. The second clinic is Shamlu Elite Spine and Pain Institute, Ben Shamlu, MD, FIPP. This one posted a 5.0 rating, 85 total reviews, 19 recent reviews, and 100% positive sentiment.
That combination is pretty striking, especially with the level of recent review activity. Patients frequently highlighted Dr. Shamlu's professionalism, expertise, and attentive approach to care. Reviews also mention positive interactions with the clinic team and a supportive environment during consultations.
And again, balanced view here. The overall sentiment reflects very strong patient satisfaction with medical care, while some feedback indicated that wait times or scheduling processes could be improved. So the praise is strong, but it's not presented like everything is magically perfect.
Exactly. Third on the list is Synovation Medical Group, Los Angeles. This clinic had a 4.5 rating, 232 total reviews, 130 recent reviews, and 89.2% positive sentiment.
That review volume is substantial, and so is the recent activity. Patients often noted the knowledge and professionalism of the doctors, along with the helpfulness of the clinic staff. A lot of the comments describe positive treatment experiences and attentive care during visits.
And with a clinic that has that much patient engagement, those trends are useful to watch. The overall review sentiment was favorable, while some comments mentioned occasional communication challenges or longer wait times tied to clinic operations.
So if we zoom out, these 3 clinics stood out among 32 pain management clinics evaluated in Los Angeles, based on review activity, patient sentiment patterns, and measurable reputation indicators over the last 24 months.
And that makes this list a helpful starting point, especially if you're trying to cut through review overload. Still, it's important to review the full article, check the clinic details yourself, and verify anything that matters to your care before making a decision.
Absolutely. Use the list to narrow your options, not to skip your own research. The full article has the clinic information and the broader context behind the rankings.
That's it for today's episode.
Thanks for listening to Review Remedy by ScoreDoc. We'll be back soon with more review-based healthcare insights. Bye, Daniel.
Bye, Ava. Take care, everybody.